Very much indeed for joining us here. Well, the US Food and Drug Administration has opened the way for a second vaccine to be approved for use in America. The Moderna jab makers claims it is safe and 94% effective, and that has now been verified, the vaccine itself. Regulators will meet on Thursday to discuss authorization, and shipments could begin within 24 hours. The US has recorded more than 300,000 deaths so far from COVID-19 and more than 16.5 million infections. Well, to look at the challenges of the vaccine rollout, in particular with the Pfizer-BioNTech and then what's coming, let's speak to Dr. Robert Amler, who's Dean at the New York Medical College and an expert in public health. The Pfizer-BioNTech vaccine is particularly difficult to transport, isn't it? Is America's infrastructure up to this, do you think?
Yes, it is. We have, of course, right now a race to the top with a lot of vaccines coming online, now more than one by the end of this week. You're exactly right on the difficulties of distribution and transportation, and storage and handling along the way. But we are certainly up to the task. There's a big worry about temperature control for the first vaccine, since we're told it will only work when it's stored within a limited range of temperature. But everybody has been stocking up on minus 80-degree freezers in advance of this, anticipating the need.
And in terms of the distribution, will the military be needed, or are other avenues available?
It's really all hands on deck. Everyone who can help is pitching in. The military, the governors, the state health departments and local health departments, and of course the CDC, Center for Disease Control in Atlanta, as well as the FDA, Food and Drug Administration, just outside of Washington. Everyone is working together on this.
I don't know if you were able to hear our previous guest just talking about vaccine hesitancy, or people who are vaccine skeptics. Is that more of a problem in the United States than perhaps one would imagine?
Honestly, it's the same worldwide, whether you're below the equator or above the equator. My colleague in New Zealand and I are 100% in agreement that hesitancy is a natural human phenomenon. After all, we've all learned to be cautious about this terrible virus. It's a big risk. But is there risk for the vaccine? The answer is very minimal. And the risk pales in comparison to the risk of getting the virus, getting sick, passing it on to friends and loved ones who may even go on to die. So when people begin to understand the relative risk between taking the vaccine and getting the virus or passing it on to others, most reasonable people will go ahead and get vaccinated.
What sort of nudging does that require, though, from the government and the new administration in terms of perhaps well-known people, identifiable celebrities, political leaders being seen to have this vaccine?
You know, that's a great question. I would say the answer is not nudging, it's listening, understanding what it is people are concerned about, making sure they understand the risk of the virus. And celebrities have a role to play as well as journalists in getting the word out. In the 1950s, we have a great picture of the great Elvis getting a polio vaccine. And in the 1970s, when measles vaccine became more widespread, we actually had a poster of R2-D2 and C-3PO from Star Wars saying, "Parents of Earth, are your children immunized?" So celebrities of every stripe can also join the effort.
OK, be interesting to see what happens. Dr. Robert Amler, thanks very much for joining us on the programme.
Thank you for having me.
Stay with us here on BBC News. Still to come.